Pandemic, I think, was the pinnacle in my career in terms of fear. Even though I was in the Iraq War, and that certainly was very frightful and very fearful, and you really worried about if you would make it home, the pandemic was the one thing that was affecting the entire world. This is the first time in military history that we were called to do a mission in the United States. Because of this unknown enemy, the pandemic, and the uncertainty, and no one knew what to do, it became clear that the military needed to assist. We were called up and activated all across the United States. 2 brigades, this is extraordinary, were called, which is about 500 plus people. We didn't know what to expect. And we get there in New York, bus after bus, hundreds and hundreds of soldiers coming together, and we get in this large, empty Javits Center. It's a convention center. It's not your normal hospital. So how are we going to set up a hospital in this empty convention center? And that's when I had the opportunity to see exactly how resilient the military can be and how we can respond. We all came together as one to do everything that we could do at great risk. I am proud that not only we survived that, but everything that I had ever learned in the military was activated at that moment, at the highest level. Of course, now I'm a senior officer. I was a lieutenant colonel. In fact, I found out I made colonel while I was at the Javits Center. My staff called me one day and said, "Ma'am, you made the list." We had 3 days. I was told, "Colonel Curtis, you are going to be the chief nurse. You need to get this hospital going in 36 hours. And I had over 400 or 500 people there, and we needed to get that hospital going. And so I did exactly that. You'll be surprised what you know what to do, even if you don't think you know what to do. But I'm thankful that I have the skill set and certainly the desire, and there wasn't any time to be fearful. We just needed to do what we needed to do to help the people of New York, and that's what we did. And we came together and we put together a 2,800 bed hospital. 500 of them were fully active, but we could definitely flex to 2,800, and we brought in over 1,095 patients out of New York hospitals in 50 days. I can tell you that anything is possible when you work together as a team, and that can only be done in the military medicine.
Throughout the 2021 season, the Dodgers, with the SoCal Pipe Trades District Council 16 and IBEW NECA of LA County, are thanking and paying tribute to the men and women of our nation's armed forces by honoring a military hero of the game. Today, we are proud to salute United States Army Nurse Corps Colonel Leslie Curtis-Glanton. Colonel Curtis-Glanton has 30 years' experience as a health professional, 10 years as a civilian nurse, and 20 years as a military Nurse Corps officer with 2 combat tours to Iraq. The colonel's proudest moment of her career was when she was deployed to New York with the HHC 11th Field Hospital in response to COVID-19. As a team, she stood up a 2,400-plus bed hospital in 3 days to help the people of New York. Colonel Curtis-Glanton served as the chief nurse and worked with military services and civilian professionals at the height of the pandemic to care for nearly 1,100 COVID patients in 50 days. Her awards include the Meritorious Service Medal, Army Commendation Medal with 3 oak leaf clusters, Army Achievement Medal, Army Meritorious Unit Award, National Defense Service Medal, Global War on Terrorism Expeditionary Medal, and Combat Action Badge. Colonel Leslie Curtis-Glanton, the Dodgers thank you for your service, sacrifice, and dedication to our country.